Welcome to this webinar, Talking to Your GP About Pain, produced in collaboration between Arthritis SA and the Country SA PHN. Did you know 1 in 5 of Australians live with ongoing pain? This can also be called chronic or persistent pain. It is pain that is occurring frequently for more than 3 months, and that's beyond the time that most tissues will have healed. Chronic pain is different to the pain from a recent injury. Chronic pain is more about the nervous system and brain that processes pain, and less about tissue damage. In short, it is more complicated. All pain is invisible, and that can make it hard to describe to your GP. And it's even harder to discuss a complex problem like chronic pain and how it affects your life in a short appointment. As 1 in 5 of all GP appointments are made to discuss pain, this webinar was made to give some top tips on how to communicate best. Research shows that only 15% of patients fully understand what their doctors are telling them during the appointment, and that 50% leave the offices uncertain of what they need to do to take care of themselves. We hope that after listening to this short webinar, you are better prepared, can communicate more easily, and leave the doctor with a clear action plan. Clear communication about the problem of pain is vital, as it can help your doctor create a clear treatment plan with specific goals and ways to measure if the plan is working. There are 4 areas we will discuss briefly. Firstly, we'll provide some practical tips that can help improve the conversation about pain. Second, we will provide some advice on preparing for the visit ahead of time. Third, we will look at other health professionals who may be involved in your plan for tackling chronic pain. And lastly, we will consider what the next steps may be after that first successful visit to discuss your pain. GP appointments can be short, with many things to discuss. It can be difficult to remember everything and easy to get sidetracked. When pain is feeling overwhelming, it can also impact your ability to recall information clearly, and then important pieces of information may get forgotten. Whether you are the person living with ongoing pain, a family member, friend or caregiver, we've outlined below a few ideas to help you discuss ongoing pain with your GP more effectively. Set up your visit for success with these simple ideas. Be focused. Make an appointment just to talk about your pain. When you have a number of health conditions, it is easy for pain to get pushed to the bottom of the priority list. Whilst it may be hard to fit in yet another appointment, dedicating the time and focus that pain deserves by organising an appointment just to discuss it can be useful. Make time. Ask for a longer appointment if needed. Most general practices allow you to pre-book longer appointments if required. Taking a little longer to have the conversation in the first place may mean less adjustments of the treatment plan in the long run. Be prepared. Write down a few short points to help you stay on track, and you could even give these to your GP if need be. It's very common for people to forget key items or remember their past medical issues in the wrong order, so putting aside a little time to make a simple bullet point list of key points can be a good memory aid. Using My Health Record, the government digital health record system, can also reduce the amount of information that you need to remember for each appointment. Consider taking someone with you. If you are anxious or feel you may have trouble expressing yourself, or perhaps remembering the conversation later, having a support person can assist you. Pain is hard to describe and invisible to others, so it's important to try and find a way to explain your pain to your doctor in a clear and simple way that both of you understand. So how to describe it? There is actually a language to describe pain, and if both patient and doctor are speaking the same language, this makes communication easier. How and where do you feel it? Being able to provide a brief rundown of where the pain is and what affects it can help the doctor identify what is contributing to keeping this pain going. What have you tried to reduce your pain? There are many options to reduce the experience of chronic pain, so understanding options you could incorporate can help focus your pain plan. How is the pain impacting your life? Pain is a physical symptom but also affects how we think, act, feel, and our overall quality of life. Seeing the bigger picture can ensure the goal of the treatment plan also matches your current life priorities. Preparing for your visit. Here are a few questions that the GP may ask about your pain. Thinking about these beforehand and preparing a few answers can be useful. How long has the pain been a problem? Has it been there for more than 3 months, in which case it could be chronic pain? Is it a new pain? Or has it happened before? Do you recognise the sensation? Where in the body is it located? Does it move from one place to another? Or is it in more than one area? If so, which location is most painful or most bothersome? Describing how pain feels is best done when you are actually experiencing the pain. So have a look at these questions on this page and maybe jot down the answers at a time that you actually have the pain, as it can be hard to remember the details later on. How severe is the pain? Is it mild, moderate, severe? The doctor may ask you to rate the pain from 0, which is none, up to 10, which is the worst pain you can imagine. It is important to note that this scale does not have any impact on your personal pain tolerance. It is your current experience of pain, and it is a way for the doctor to tell later on if treatment has changed it for you. Here on the slide is a version of the 0 to 10 pain scale that uses words to describe intensity instead of numbers. Some people find this easier. What words describe the sensation of your pain? Would you say it is sharp, stabbing, dull, aching or burning? Is there any numbness, tingling or weakness in the area? This gives important information to the doctor about which parts of the nervous system may be contributing to the pain. How does your pain vary? If it's a pain that comes and goes, it may also be called intermittent. Other pains may be constant. There may be times of day when the pain is at a different intensity, or perhaps there's specific activities that you can identify that make your pain better or worse. What have you tried to reduce your pain? There's many simple ways to address ongoing pain. Self-help measures like heat packs, cool packs, moving the body part, or taking over-the-counter medications. There's no need to provide too much detail, but the doctor will want to know if there are approaches that have been missed, or some that showed promise and helped a little. Research has shown that medicines for pain generally help 1/3 of people reduce their pain by 1/3. This may surprise you if you thought they could do more. This is why there needs to be a combined approach of using more than medicine for tackling chronic pain. What is the impact on your life? As we said earlier, pain is not just a physical feeling. It can impact your life in many ways, and it is important for your doctor to understand this in order to help you manage it. How does the pain interfere with normal, everyday activities? Are you having difficulties with specific activities? Maybe at work, or your duties for looking after children, or driving? How has the pain affected your emotional well-being? Are you feeling down, depressed, anxious or isolated? Sometimes the changes that occur because of chronic pain can be a problem in themselves, and tackling them directly, rather than waiting for the pain to go away, is a sensible idea. So it's valid to address the impact of pain as well as pain itself. Your doctor may not have the solution to all the problems, but they can refer you to other individuals who can help, and we'll explore some of these other individuals next. Who else can help? One of the most common health professionals that works with people in chronic pain is the physiotherapist, or physio. They can help your body return to health and normal function. Whilst we need to rest an acute injury for the body tissues to heal, when pain has gone on for more than 3 months, the tissues will have healed the best they can. And now it's important to return the body to full function by a combination of strengthening, stretching and moving. People living with chronic pain will often find that it does hurt to move, but can be reassured that moving gently under supervision will not cause any harm. It's really important to strengthen the muscles, get the joint fluid moving again, and get back to normal. Physiotherapists are experts in movement, so they can provide a personalised program of stretching and strengthening, to rebuild fitness and flexibility in your joints and get you back to the life you want. Exercise physiologists, also known as EPs, are also university-trained health professionals that use active approaches to help your body return to health and normal function. Exercise physiologists can provide tailored exercise programs that not only account for your pain, but can also target other areas such as cardiovascular fitness, weight loss, or blood sugar control. It can be hard to find exercise that accounts for all of your body's different health needs. So seeing an EP is a way to find a program that can be successful and a person to motivate you to stick at it. Psychologists are experts in helping people cope with the thoughts, feelings and behaviours that accompany living with chronic pain. They can be very important members of your team. The mind-body connection is very real, so psychological treatments are an important part of pain management. Understanding and managing the thoughts, emotions and behaviours that accompany long-term discomfort can help you cope more effectively with pain and may also reduce the intensity of your pain. Occupational therapists, also known as OTs, focus on promoting health and well-being by enabling people to participate in the everyday occupations of life. Pain can prevent you from undertaking your work, undertaking your care duties, or just doing the hobbies and things that you love in the usual way. But the skills of an OT are to use ergonomics, aids and devices, and joint protection principles to allow you to get back to doing these things, even if it needs to be done a little differently. Not only may they provide aids and appliances, but they can help teach pacing to manage fatigue, or tackle the ergonomic challenges of everyday activities so you get back to doing what you want. We encourage everybody to make a pain plan. This enables you to make a plan to move forward. When thinking about the way forward, be open to new ideas. There are a number of different approaches for tackling ongoing pain, and it is rarely just one approach that will be successful. Research tells us that finding out the approaches that work for you and then persisting with them provides the best outcomes. What's in your management plan for pain is a shared decision between you, your GP, and the other health professionals in your team. But when deciding what will be in and what will be out, there may be some questions you need to ask. For example, what are my options for treating the pain? What could be the benefits of each treatment? But then what are the risks and what are the possible side effects? Getting answers to these questions will help you make an informed decision on your pain plan. If you're living with chronic pain, it's quite normal to have more questions. Here are two that we get frequently. Can I find out more about chronic pain? Yes, you can. Chronic pain is a complicated subject, and by learning more about it, you will actually find out more ways to reduce its hold on your life. Ask your treating health professional for more information, or consider some reliable sources of information online. Arthritis SA has 2 online courses you can access for free. Ways to Cope with Ongoing Pain is a short e-course. You can access it from a computer, from a phone, or from a tablet, and it will automatically resize to make it easy to use. It goes through 6 simple skills that have been shown to help reduce the impact of chronic pain. Finding help for pain online is more of a one-stop shop. It shows you where else to look to find out reliable information about chronic pain, where to find services, support groups, alternative courses, books, and so much more. Perhaps you're wondering if you need to see a specialist. Depending on your circumstances, there are many different types of specialists who could be involved in your medical care. Your GP will refer you to appropriate specialists if required. They may also undertake a chronic disease management plan in order that a range of allied health professionals can support your plan to tackle chronic pain. This is the end of this brief webinar about talking to your GP about pain. Here's a reminder of the main points that we covered. Always be prepared for your visit. Make sure you have enough time. Learn the language of pain in order to be able to describe it. Be open to new ways to tackle it. Always take a team approach. Be involved and learn more about your condition. If this webinar has raised some issues that you'd like to discuss, or you simply want some more information on dealing successfully with chronic pain, please contact Arthritis South Australia. The screen is displaying our two numbers, our office number 8379 5711, where you can ask to speak to one of the health services team, and our 1800 number for our advice line. You may also reach out through our website, via an email, or through Facebook.